On the occasion of World Hepatitis Day, which we used to celebrate on every year on 28th July, to create awareness about viral hepatitis, which is a very common disease in India as well as the entire world, which leads to significant morbidity and mortality. So, to create awareness, I am telling you about viral hepatitis. Viral hepatitis is a viral infection which usually affects liver and other organs, but predominantly affects liver, and because of this, patient develops jaundice and other symptoms. It is usually of 5 types, but commonly we used to see patient of 4 types like A, B, C, and E. Out of these, 2 viral hepatitis of A and E are usually transmitted by the are said to be waterborne diseases. That means they spread by the contaminated food ingestion. If there is some contamination in the food, like in vegetables, fruits, or water that is contaminated, that leads to these 2 viral infections. While hepatitis B and hepatitis C are usually transmitted by the blood or blood product, either infected syringe, infected blood product, or transmitted from mother to baby. So I will tell you little bit about each and everyone, and then tell you about hepatitis B in detail. So while hepatitis A is a self-limiting illness, it is commonly seen in children of school-going age, and most of the time in school-going age it remains silent and without much of symptoms. It resolves in 4 to 6 weeks. But once it happens in adult, now we are used to earlier we don't see hepatitis A in adult population, but nowadays quite a lot number of patients of adult age comes to with us with hepatitis A, which leads to slightly increased severity of illness with prolonged cholestasis. So patient usually present with initial history of fever, malaise, anorexia, vomiting, followed by jaundice, which gradually increased to a peak and then subsided in 4 to 6 weeks. Here I want to emphasize one thing, that once you have jaundice, don't take any medication like Ayurvedic medication, Desi medication from anybody. That leads to more harm than benefit. So, because it's a self-limiting illness, the only remedy is symptomatic. If patient is having fever, we used to give antipyretics. If having vomiting, then we give medication for vomiting. And as far as diet is concerned, there is no restriction in food for hepatitis A patient. You can give normal food, no need to restrict haldi and other things. You can give normal food to the patient. And it is a self-limiting illness, it will subside within 4 to 6 weeks. Coming to hepatitis E is also a self-limiting illness which usually happens in adult, which commonly see in adult population of routinely in large number of patients. Again, it's a self-limiting illness, no medication is required, only treatment is symptomatic, and patient need rest and nutritious diet to recover. Which happens usually in 4 to 6 weeks. So hepatitis E again doesn't require any particular medication, or don't give any Ayurvedic medication for such a patient. Coming to the hepatitis B, it is usually transmitted by parental route. That means either from the blood or blood products, or by the infected needle, or from mother to baby. And higher risk of transmission is also seen in homosexual persons. So these are predominant route of transmission, and it has a particular pattern of usually it doesn't present as a jaundice. It is usually documented on the routine screening, either in the case of pregnant women during the pregnancy. On screening it was found to have that they have hepatitis B viral infection. Another group is patient is going for Gulf countries or some other countries, and on visa screening they found to have hepatitis B. Or some patient on routine blood testing found to have increased SGOT, SGPT, and then on workup found to have hepatitis B. So these are the predominant mode on which we found hepatitis B infection. Since it is a silent infection, so it is also called as silent killer, because it gradually affect person without leading to any notice. And once patient develops symptoms, it's already too late. So here comes the importance of screening. So everybody should screen for hepatitis B if it is at a high risk. Suppose somebody in your family has hepatitis B, then entire family should screen for hepatitis B. And if they are negative, we have a very good vaccine available against hepatitis B. So everybody in the family should get vaccination for hepatitis B so that they can be prevented infection from then onwards. So this is the way usually we found infection of hepatitis B. A small group of patients presented to us with hepatitis jaundice, in which hepatitis B is positive. They are patients who has acquired the infection recently within last 6 months and then presented to us with jaundice, which gradually increases, and most of the time 90% cases subsided within 6 months. Roughly 5 to 10% patient remain symptomatic for this infection for a prolonged period. Then they are said to have a chronic hepatitis B infection, and that infection may remain persistent for entire life. So it's very important to screen for hepatitis B, and if you are negative, then take hepatitis B virus vaccine against that. As far as treatment is concerned, if you have hepatitis, you are found to be hepatitis B positive, consult your doctor who can screen you whether you need treatment or not, because one stage in hepatitis B infection is inactive carrier stage, in which though there is virus in your body, but it is not causing any infection, any harm to your body or any damage to the liver. So in that case, doctor will screen you whether you are in inactive carrier state or you are in active replication phase. If you are in active replication phase, then you require treatment, and then the doctor will give you a treatment for a prolonged period of time. If you are in inactive carrier state, then you doesn't require any treatment. That has to be decided by some doctor. So once you are found to be hepatitis B positive, then consult some doctor. As far as protection is concerned, vaccine is available. This is usually recommended for anybody in hepatitis, anybody having family member hepatitis B positive, and close contact of that patient should receive hepatitis B vaccine. Similarly, if you are in high risk profession, then you should receive hepatitis B vaccine as well. And prevention, I have told you. As far as treatment is concerned, that has to be decided by some doctor. This is about hepatitis B virus. Similarly, hepatitis C virus is a parental transmitted infection which transmitted by the blood and blood products, and it also leads to chronic hepatitis and cirrhosis, which is a complication of hepatitis C, B and C virus infection, which leads to formation of nodules in the liver, and further worsening leads to development of ascites, jaundice, encephalopathy and bleeding. So our aim in hepatitis B and C is to prevent progression to cirrhosis. So it's very important for patient with increased SDOTPD to evaluate for hepatitis B and C virus infection, and if they are positive, they should consult some doctor so who can screen them and give appropriate treatment. As far as hepatitis C is concerned, it leads to chronic hepatitis. A very good antiviral drug is available, which has a finite duration of approximately 3 to 6 months, and that drug has efficacy of 90 to 95%. So if anybody found to be hepatitis C, should consult a doctor so he can give you a proper treatment, and you can be cured of hepatitis C virus infection. So take home messages, for hepatitis A and E, you have to keep a good hygiene. Try to avoid outside food during monsoon season, because it is a very season in which this sort of infection happens. So avoid outside food. Don't take anything raw which is available outside. If you have to take anything raw, take it to home, wash it properly, and then only take it. And similarly, wash your hand before taking any meal and after defecation and urination. So hand hygiene and food habit hygiene is a must to prevent hepatitis A and E infection. For B and C, proper screening and consultation with doctor and proper treatment is a must. So these are the take-home message for you on this World Hepatitis Day. Thank you.